Well, good afternoon, everyone. We're letting everyone in from the waiting room, as we call it. So let's just give it a second for everyone to enter in. Okay, well, I'm gonna go ahead and get started. I'm sure that we'll have others join as we begin today. But I don't know about you, but I know exactly where I was at the time that this proposed final rule came out, and I went, "What? No." That much? I mean, I really did have some comments, and I kept going to other people's websites that I know always come out with the final rule, the first comment, and I just kept shaking my head and saying, there's just no way. And so, over these last couple of weeks, since the proposed final rule, Kyle and I've had great opportunity to talk with the Alliance, the National Association, about what is happening on the Hill, especially prior to the August recess, and what they were doing to try to create a pathway of, who to talk to and what they might be able to do. And it's helped us in some of the creation of, what Kyle created today, specifically regarding our advocacy efforts. I think over the years, if you've ever written, a comment and sent it in, that, CMS's responsibility is to read all of them. And you'll often see when the final rule does come out and it's, 400 pages long, that they highlight someone's comment and that they made a change to this particular part based on this person's comment, and this person added this. So they really are reading them and include them in that decision making for the final rule. I was pretty disappointed the other day when I logged on to the Action Center for CMS, and I think I saw 7, I believe, was the number of comments that had been submitted. And it was a few weeks back, so I hope that some providers have begun to do that process. But today the goal for us, knowing that we only have a short period of time until the CMS closes that opportunity for us to give the public comments. We only had a certain amount of time, so we know that's August 29th, and so we want to be able to help you to present your comments. So really, that's what we're going to do today. Kyle's going to kind of go over a little bit of what the overview of the proposed final rule, why your voice matters, and take you to our Legislative Action Center so you can use Kyle kind of walked you through then how you can add your comments and crafting that message. So we're going to get right to it, Kyle.
And Denise, I can also say I just looked at the proposed rule website, and the QR code on the next slide is where you'll be able to take a look at that. But there have been 3,574 comments received, and you can review comments to help craft yours, as well as follow along here and hopefully be able to craft some effective comments to submit by the August 29th deadline. But starting back from the beginning, the proposed rule, that CMS docket ID, that's what would be referenced in your comments. You don't have to worry about that necessarily, but it helps if you want to look it up that way. If you are submitting comments by mail, I encourage you to do so very soon, and you would reference that in your comments. So this proposed rule is a net 6.4% cut to the Medicare payments over this year. So for 2026, that would take effect on January 1st. That is $1.135 billion and a reduction to the payments over, again, the 2025 payments. The gross, however, before that inflation update, as you can see at the bottom, 2.4% market basket increase. That was actually a 9.06% cut that CMS was calling for. And that 2.4%, as you're probably well aware, is completely insufficient to offset the cuts that we've had year after year after year. You can, the breakdown here of the changes: 4% permanent behavioral adjustment, 5% temporary recoupment for services, for money for services that you've already provided throughout the dark days of COVID. 0.5% outlier recalibration, and again, that 2.4% inflation increase. That QR code will take you to the CMS, or I'm sorry, the Federal Register website, where you can look at the comments that have been submitted. You can also submit comments directly through there, but we would encourage you, we hope we've made it easy enough for you to use our Legislative Action Center to weigh in. And if you have any questions, please save those for the end, but on the permanent behavioral adjustment, the temporary recoupment, happy to walk you through all of that as well. So key concerns. First is this is a flawed methodology. We've been saying this for years. There has been legislation in the past. There have been hearings in Congress where CMS has come before Congress, and as well as providers and other stakeholders have come before the Congress to inform lawmakers about exactly what is going on. And the issue really stems from CMS using simulations of the pre-PDGM payment system based on partial claims data. So that assumes that the conversion between these payment systems is accurate. It is not. It's unrealistic. We are unable, for the past several years, the National Association for Home Care and Hospice, now the Alliance, has tried to duplicate what CMS is deriving whenever they look at the claims data, and it's been impossible. So they are comparing apples to airplanes, essentially, and without being able to have a solid conversion, an apt conversion, then we're going to continue seeing these cuts every single year. CMS has corrected this for similar issues, specifically going back to 2023 for skilled nursing facilities. They had one payment system. They went to, I think it's the PDMP or something like that. And so whenever it was pointed out in provider comments that it's not an accurate conversion, CMS admitted it and they agreed. So they were able to adjust for nursing homes, but not for home health so far. So that, again, that disconnect between the models will continue causing annual cuts. It also ignores congressional intent. In the PDGM legislation from 2020, Congress called for budget neutral 30-day payment transition, not across the board cuts as we've seen. You can see the reduction in spending as a result of that. We're down 12% since just before COVID. So now this is a $15.7 billion, the fee-for-service benefit as of 2023, and that's continuing to decline. Very recently, Republican senators, the Republicans control the U.S. Senate. Senator Susan Collins, one of our biggest champions, and Senator Marsha Blackburn wrote to CMS and called out the imposed sweeping reductions that Congress actually never called for nor intended. So we do have some congressional support. Hopefully, if the CMS proceeds to finalize this rule as proposed, that perhaps legislation will come forward in the Congress to effectively stop this rule from going into effect. So they are watching, but we do need to make sure that the voices of the provider community are heard loud and clear. And like I said, so far over 3,000 comments submitted, and that is phenomenal. But we have to make sure that Florida is being heard as well. But going back to the concerns of data integrity issues, methodology includes claims for fraudulent actors. So of course, if you're looking at if there's fraud and abuse in the initial system or the system that preceded PDGM to PDGM now, then you're going to continue having what the outcomes or what they're seeing as behavioral assumptions and these adjustments are going to be based on that. And just an example, there are over 1,000 new home health agencies in Los Angeles County alone since 2020. We know here in Florida that we have some hot spots or have had hot spots in the past that have contributed to the change in the payment systems over time. And so if they're not accounting for that in these proposed rules, then again, they have some serious flaws, methodology flaws that will not correct course until we are able to make our case effectively. Operational impact. The permanent and temporary adjustments are unsupported by actual provider behavior. I think CMS thinks that's beside the point. And also, it does not account for inflation, rising labor costs, and the regulatory burdens that we're continuing to see increase. So why this matters, the outcomes are going to be more negative outcomes, also eroding access to care and workforce crisis. The nursing shortages have been here and severe for half a decade now, if not longer. That only continues to get worse as other sectors are able to pay more. But the nursing shortages, wage inflation, Medicare Advantage underpayments, that's a whole different story, of course, as you're aware. But what it's leading to is higher mortality, higher Medicare spending per episode without home health, Agencies are turning away referrals. There's a 10% of referrals wait 5+ days. So there's across the board when it comes to access, outcomes, and how it affects the workforce. It's very harmful what these cuts have done and are continuing to do, and that's why we have to stop them. So the urgency to act, just some data here. By the way, you'll be provided this slide deck as well as a lot of fact sheets from the National Alliance for Care at Home. But looking at access, over 1,000 home health agencies have closed since 2019. Half of US counties have lost at least a provider. Here in Florida, we've lost 144 agencies. Not all of those are Medicare. Unfortunately, that data wasn't readily available, but this is in the past year. Many of those are Medicare certified, and many are in high need areas. 80%, more than 80% of counties now treat fewer traditional Medicare, that's fee-for-service patients, and provide fewer visits. And of course, rural communities, those face the steepest losses, longer wait times, and amid severe provider shortages in these care deserts that are popping up because agencies are closing or consolidating. As it relates to patients, 39% of patients referred after hospitalization never receive home health due to capacity constraints and workforce shortages. And the loss of care risks, it's increasing the risk. So 3 admissions have increased 35%, emergency department use has increased 16%, mortality 43%, and overall spending has increased 5.4%. So this is just bad, across the board bad for patients, for providers, and for the longevity of the benefit long term. Financial distress, Medicare spending on home health is already down 12% between 2019 and 2023. And it's estimated that over a third of agencies are operating at negative margins as of 2023. And that's projected to reach 45% by 2027 and 60% by 2040. So just think about your agency and what you're seeing with the declines and being able to take in, or first off, accept Medicare patients, but also what these cuts are doing to your bottom line. It's not the case anymore where Medicare fee-for-service is subsidizing Medicare Advantage or Medicaid. We are seeing across the board these rate reductions from Medicare Advantage plans, rate stagnancy from the Medicaid plans, Medicaid and the plans, and now Medicare fee-for-service is being squeezed until, what are you going to do? They're going to go to the hospital. They're going to go to a facility. It's going to result in agencies no longer providing Medicare, serving Medicare patients. So the bottom line is that this proposed 9% cut, which is a 6% cut, will accelerate closures, it will shrink access, and it will harm patients, especially in rural and underserved areas. So now moving on to the public comments. So federal agencies, as you may be aware, solicit feedback before finalizing regulations. This is an annual process. Typically, the proposed rule comes out around July, and the final rule comes out appropriately around Halloween. But comments can influence whether and how a rule is changed. As I mentioned, the skilled nursing facility sector was effective at getting CMS to change the way that they were calculating their proposal and their final rule based on the poor conversion or the inability to correctly convert their current payment system and what they have now. We need to do the same thing. As these comments are submitted, it's critical that unique substantive feedback is provided from the provider community that carries much more weight. Some of these form letters, like a legislative action center, oftentimes it can be helpful for legislation where it's more, volume. I remember working in a congressional office, and we would simply, at some points, we would just answer the phone and tally this is pro, this is opposed to the issue when a big vote was coming up. So in those cases, it doesn't necessarily need to be unique, and it shouldn't be a form letter. It really should be your agency's perspective and not 5,000 of the exact same comments submitted, because they will take those aside. Even though they have to read every single one, they read one and they can run it through a machine and find out how many of them are duplicates. They're not going to have to read those. We want them to read them and hear about your agency's issue compared to whether you're in Orlando or you're in Tampa or you're in Miami. We want all of the agencies based on their census, based on the services you provide and based on your location in your service area. We want to hear all of those perspectives. So how it works, I mentioned the proposed rules published, outlining the plan changes and rationale. The comment period, we're in the middle of it now, followed by the agency reviewing after the comment period closes. That's on August 29th, followed by the issuing of the final rule, which will go into effect on January 1st, and hopefully will incorporate some changes based on your thoughtful feedback. So why it matters, personalized stories, local data, specific recommendations, they're very effective. I mentioned that in 2023, over 69, nearly 7,000 comments submitted by the skilled nursing facility sector led CMS to phase in a proposed 4.6% cut over 2 years, reducing the immediate financial impact. They're doing a lot better than we are these days as a result of that. So the takeaway, your comment is your voice, and you can help shape the final rule. So we need you to weigh in, and that's hopefully why you're here today. So now, the tool that we have put in place that will hopefully make this as simple as possible for you as you start thinking about your comments, which again are due in 10 days. Our Legislative Action Center is your one-stop online hub for home care advocacy. It connects you with elected officials and regulatory agencies. You can track key legislation. If you're a member of HCAF, you're able to go online year-round and see all of the legislation that we're following in Congress as well as at the state level. And it also facilitates rapid engagement. So how it's going to work for this purpose, we preloaded the Action Center with talking points, issue briefs, as well as modular comment templates for the proposed rule. So we wanted to make this easy, and you're welcome to go on and submit your own, organic comments without using anything that we prepared. But we have made it to where there's about 5 different sets based on paragraph. I wanted to provide as many options as possible so that whenever you go to that QR code and go to our Legislative Action Center, what pops up on the page, it's preloaded, and I'll show you now. But it's going to be different for everybody. This is our Action Center if you've not used it before. And this is where you'll be directed with that QR code. So here's an overview. There are some fact sheets here. There'll be some more loaded and as well as sent to you. And this is where you'll take action. So you'll type in your, I could just use mine. So preview here. Oh, wait a second. Yeah, perfect. Oh, it's because I haven't entered anything yet. That's why. So this section here, though, is where you will, the subject will change based on just whenever you go to it. It's going to pre-populate it, but there are multiple subjects. They're all different, unique subjects, as well as the way these fields will load, which you'll fill in, will be different for pretty much mostly everyone, I would say. There will be some that will repeat, but it'll repeat in the middle of the section of your comments compared to another. But that way it's not going to be, if we have, what do we have here? We have 23 people on the call. If all 23 of you went on right now, it would not be the exact same template where just the only differences would be, your census or whatever it might be. So this is hoping to hopefully to make your comments unique, not get flagged, and be thoughtfully read and considered by CMS. So what you'll do, though, is when you go here, my name is, you don't have to touch this, but you just have to use these sections. So you'll type in your name. And I am type in your title there. Type in your agency name. Provider of home health services enter the city and state. We serve your census. You can see here, so we serve 50, let's say, Medicare beneficiaries annually across list of counties. You want to, again, localize this as much as possible and offer services, including you'll continue following through. And once all of these are filled in, you're able to come back up here, preview the comments all in one, actual complete document, and click send, and this will go directly to CMS for you. So the fields that you'll see they're similar fields that are across all of the different comments that we've set up, but some of them will have it'll ask about your specific patient population instead of the number of patients you're serving. It will ask if you have any sort of workforce shortage challenges and ask you to provide an example of perhaps not being able to hire a nurse because of the cuts, and therefore what that means for your ability to serve, your patients in your community, and help get someone out of the hospital, the referral rejection rate, all of those things. So it'll ask for some stories, and there'll be a little bit more detail that it might want you to provide. If you don't want to go that far, to that level of detail, you're welcome to go into an incognito or private browser window or a different browser, and it'll pop up a different set of comments, and you can see what that one is, if it's an easier one for you. But this hopefully will help streamline the process for you entering. It's almost like an interview at this point, at the way we set it up, to where you're not having to sit there and think about how to articulate exactly what the challenges you're facing, and merely enter in some of the detail just based off what's going on in your agency, hopefully. So with that though, I would like to just first, I'm going to pivot back and just go over a couple quick things before we open it up for your questions. You can see here what I was showing you. That QR code will take you right where it just was. But crafting a compelling message. So personalizing and making it local is so key so that CMS knows the real world consequences beyond these numbers. The key elements, as I mentioned, the fields that are in these comments, the templates are your agency's services that you provide, if you are a nursing agency or if you provide PT as your primary service, what the census is, what your population looks like if you're serving in an area that's a little bit more, if you're down in South Florida versus in a rural area. But do not include any patient protected health information. We encourage you not to do that. Also, patient and workforce impacts. So talk about referral rejections if you're tracking that, adverse outcomes, unnecessary hospitalizations or ED staff turnover, reduced access, etc. Local examples and data, so zip codes, like that level of detail. Closure threats if you've had to close one of your offices or missed visits. I know you have that tracked. And then clear requests to CMS. There is a field for that. It says, we recommend that CMS withdraw the 4% cuts, stop the 5% clawback cuts, the temporary cuts, reassess with accurate data, etc. That's all in there for you. But recommendations, you can also provide your own within the comments using the template. So right now, the 60-day comment period ends at 5 p.m. on Friday, August 29th, again, 10 days out. We encourage you to share this with your staff, local providers in your community, your vendors, other stakeholders. As I mentioned, the final rule is anticipated later in the fall. And if you'd like to submit electronically, that's what our Action Center is for. Or if you want to submit by mail, that is the address there for you. You could see the uptick in the number of comments. This is critical that we are responding to this level, simply because it's got to stop or it's going to ultimately decimate the effectiveness of the home health benefit, which, as we all know, saves money. So let's open it up for questions, unless Denise, if you have anything you'd like to offer.
Yeah, so just a couple things. One is I just want to tell you how we got to 9%, because if you think what was in the proposed final rule, I think was 6.3 was the actual number, 6.4.
Yes.
But we were supposed to get a 2.4. So essentially we went from a positive 2.4 to a negative 6.4. You add them two together, you add the two together, and you end up with 8.8%. So that's how we got to 9. So if you wonder how all of a sudden we got to 9%, that's how, is when you add the two together. The other thing is that in all the conversations that we've been having specifically about this temporary recruitment, the recoupment, the 5% is only going to recoup about 750 million, I think, of what it is, out of a $5 billion that CMS feels like we still owe. And if you look at the way the current administration is going, if they think that we owe them $5 billion, they're going to try to get $5 billion from us.
Absolutely.
If you think 5% right now is only making that much of a dent, we still have all that left over. I think the other thing in comments that I would encourage is what we've also found is where there has been fraud in CMS and in home care, those agencies are now closed. So to penalize all of us who are open, who have passed all of the audits, I'm just saying, if you've done all of the requirements that CMS has asked of us as providers, then why would I pay for the penalty of someone else who was fraudulent? It wasn't me. So I guess, if yes, tell your story, but I often feel like, we miss that part that we're accountable to someone else's bad action. And
Right.
and we shouldn't have to take that anyway. So just keep that in mind, even as you're beginning your comment, how you construct your comment.
And to Denise's point, we're Florida. We are ground zero for any technical innovation that CMS comes out with, like review choice demonstration. So we've seen the worst scrutiny of providers than most states over the past several years. So I think that to Denise's point, though, yeah, we are. I think that they're checking us a little bit closer than they are perhaps other providers that have unfortunately resulted in these cuts over the past, again, many years now. But do you have any questions or thoughts for us?
So it looks like there was one, Kyle, from Mandy. Have two agencies in two regions that I fill out two separate forms. What do you recommend because of wanting to be specific for the region?
Are certainly welcome to submit to. More is better, but you're also able, if it's just easy, if it's easier for you to provide all that information in one. This is not, whenever when we're reaching out to members of Congress asking them to co-sponsor legislation, you'll need to enter one address because it will go to that one member of Congress for each of those offices, perhaps. This is going to CMS, so it doesn't make a difference if you are referencing two agencies. Just be sure to say this is an agency that serves this area and this is an agency that serves this other area, to make that clear.
Mhm.
Especially if there's a distinction between the types of patients and the number of patients that you're serving, and if you're in a rural area versus in one area versus an urban, and so on.
So what we are going to send at the end today is certainly the PowerPoint that Kyle did, but there is also several items that the Alliance has gone out and been able to collect data from several different sources to help each state create their data specific to them. So if you're looking to be able to um,
I will be adding them here too.
document in your verbiage that you use something about some data related to in fact, all the data that Kyle, all the numbers that he had, those are all found in the things that we'll send you. So that will help in that you feel like, you're confident that the data that you're submitting is accurate, etc.
Yes. Well, we're right at almost 30 minutes here. Do know that we will be submitting comments. HCAF will be submitting comments on behalf of the Florida provider community, as well as the National Alliance will probably be signing on to those too. And those tend to be very dense and detailed. So again, it is key that you just make your comments really reflect what the, again, real world on the ground level experience that you're having as an agency, and what the potential implications are for your business and your workforce and your patients if these cuts continue. So you don't have to get into the weeds with some of the documents that I will be sharing and adding to the Legislative Action Center. That background that Denise mentioned, some of it does just that, but there's also some really good tips in there too for how to craft your comments.
Mhm. Well, I'm not seeing any other comments. Jessica, do you see anything else? Or Kyle?
See
I
something
don't
in the
see
chat?
anything else, so I think Kyle must have answered all the questions that everyone had.
Everyone just get to work. It sounds like you're all on board, ready to go.
The template
Good.
is really user-friendly. TY. Thank you, Austin.
Exhausted. Good.
Awesome. Thank you.
All
And it
right.
should be
Sounds
editable
great.
too. It should be very editable if you want to make any changes, not only in the area that we're requesting the information, so feel free to do that too. But yes, if you have any issues with that though, just reach out. We're here.
All right, y'all. Thank you so much. Have a great day.
Thank you.